I actually felt a little twinge or something, but I had a virtual exercise class I wanted to do. So I did it and I felt fine the rest of the day and evening. I felt perfectly fine. So I didn't give it another thought. The next day, I awoke to some chest discomfort. Nothing like a lot of people say an elephant on your chest, or I had no pain down my arm. I had no, no chills or sweating or jaw pain, nothing like a lot of women, a lot of the signs that women get. I just had a chest discomfort.
Ann Ertl was feeling a little off, but not awful, when she went to see her primary care physician, Dr. Robert Mandel, last winter.
You try to think of, what is the worst case scenario? If I don't get this correct, what might I be missing? So, when she came in, one of the things you think about is this cardiac related? Noting that she had had family history of heart disease, she has a personal history of cholesterol, that she possesses some risk factors that could have suggested that this was cardiac in nature. So you jump into action and you make sure that's the case or it's not the case.
Dr. Mandel performed an EKG. It showed a difference in heart patterns, suggesting an acute heart issue.
In the moment, what was occurring is something that we call angina. So angina is chest pain that is caused by decreased or lack of blood flow to certain areas of the heart. She was experiencing that in that moment, which ended up leading to her chest pain.
Came in and told me that the changes were significant enough that I did have to go to the ER, and my husband was out waiting in the parking lot. He could not take me. I had to have my first ambulance ride, went to St. Joe's Medical Center's ER.
Once she entered the hospital, the team had already contacted cardiology to let them know that she would be arriving, where she ended up getting much further evaluation and workup, and then eventually ended up being taken to the catheterization lab, where she ended up, getting full treatment.
A catheterization showed one artery was 95% blocked, another 65%.
I was 69 years old. I never had anything. I was, a pretty hale and hearty person, took good care of myself. So it was all shocking to me that this kind of kept unfolding, that I wasn't being sent home from the ER.
Her hospital stay wouldn't last long, though.
Within 24 hours, literally, everything was done. Everything was diagnosed. The catheterization was done. The stent implanted. I was home within 24 hours. It was unbelievable.
Ann chose to take charge of her recovery through Penn State Health St. Joseph's cardiac rehab program. It includes diet and nutrition education, as well as strength and exercise.
You can do 2 or 3 times a week. I was comfortable with 2 because I had my own virtual exercise classes to do. So I went 2 times a week for 3 full months. And I can't say enough about them.
I would say that following everything that Ann has been through, that she's doing excellent. She continues to follow up with both her primary provider, who is myself, and then obviously her cardiology team. And we continue to control as a group her, we call them modifiable risk factors. So making sure that cholesterol, those blood pressures, that things are controlled and that we are controlling the situation as best we can to maybe avert further issue.
With Ann back in good health, she's able to return to what she loves, volunteering with Meals on Wheels.
I get way more out of it than I give. It isn't just the meal that you deliver, it's the time that you spend with people. It's just so heartwarming to see how they feel when they get the meal, because it's, as I say, not just a meal. It's sometimes you're the only person they may see in a day's time.
Serving others while thankful for the service she got from Dr. Mandel and Penn State Health St. Joseph Medical Center.